with the
Afterwards, the cream is put on. Yeah.
Okay.
And we are going to do that here in a moment.
Are you going to use sunscreen?
It has been put on already.
Okay.
So you just do it before the curettage, the sunscreen before the curettage?
Yes.
You don't have to put it on.
Why? Why do you put first of all the sunscreen?
Then it will go into the skin, and I only remove the superficial part. It's not a deep scraping. It's only superficial. And when you feel it that you are hitting an actinic keratosis, then you take that away, and then will come a little bleeding from that.
Okay.
So now I will start to do it, and it may hurt a little.
Okay.
So if you need a pause or something, just tell me.
Do I need to stop?
Yes.
I just say stop?
Yes, and then you will get a tiny pause.
You can squeeze this, so you won't punch the doctor.
I will start now.
Oh yeah, really? I just do the breathing thing.
No.
Yes.
Yeah.
So I do it all over. If you have many keratosis, you will also have them where you don't see them. The beginning of them, and it's a good time to treat them. So the whole area is treated.
Is that painful, David?
Beg pardon?
Is that painful?
Is that what? Central?
Painful.
Oh, painful?
Uh-huh.
No. I'm Canadian.
That's good. The spirit.
No,
I'm proud of you.
it's not really painful. I can feel it for sure, but it's not really painful.
And also the advantage of putting the sunscreen is that it's smooth.
And
It's
I'll
smooth
keep
so
this as a
the
souvenir.
crust.
Yes.
So
It reminds me of
So
something
then-
else, but we won't talk about it.
then it's easier to do the curettage because the skin is already smoothened.
And it is true that this is clearly a seborrheic keratosis.
I'm ouch.
Teníamos unos polvitos, ¿se acuerdan?
Yo tengo
toquecitos.
Para los
No está contento. Ahora sí. No se pica.
I'm sorry to hear you can't do it all at one time.
Doctor,
We'd
do
have
you
to
apply
do this
anything?
again.
Do you apply anything to stop bleeding if you have
Just
any
a compress.
or whatever?
We normally just compress it.
Okay.
Exactly.
So, and if the patients cannot reach their home within half an hour, then they have to be outside here at the building or something like that. So,
2 hours, right?
2 hours of light, but the first half hour is not counting.
Okay.
You can be outside and you can be inside. That no PP9 is formed before the first 30 minutes has left. Then it starts to get quickly up.
Okay.
So nothing really happens the first half hour.
So I shouldn't wear a hat.
Not today.
Okay.
Is it still hurting?
And after 2 hours, you have to rinse.
Beg pardon? After 2 hours, I have to
Take a shower to take the cream off.
shower. Oh. Okay. Well, I live.
And then I had from now on.
Yes. Oh yeah. I live about an hour from here.
Yeah.
So you're saying I should walk around outside for half an hour and then get in the car, drive home, and have a shower?
Just
No, yeah.
wash it off with water. That's
No.
That-
You should go outside and stay for 2 hours here
Oh.
before you come back home.
Oh, so okay. So 3 hours from now, then I have a shower and wash it off.
Yes.
Yes,
Okay.
we're gonna give you all on our prescription, all the instructions.
Okay.
Yes, but we'll
Are
be like
you
2
going to
hours
give them to
working
me in
around.
Spanish or English?
English, that's your wish.
¿No le duele?
No.
Ok.
Y no le pusieron anestesia.
No, you don't need anesthesia.
No.
It's not painful.
You're French?
Yes.
I hear some words in French.
Okay. I mean, this is why also I understand Okay, the Spanish, because it's really close.
Because accent is French, English, French.
Yes.
You can see now and then I hit a small, nearly invisible actinic keratosis, and then it drops off.
You never put anesthesia?
No,
No?
Pregúntale si no se le han implantado cosas.
if the lesion
Anybody runs when you start to work? Anybody runs? Anybody go away fastly?
are you afraid that will run?
She asked to me. She wants to know that.
Are you okay?
Yes.
Yes.
So now you have proven that it also works on Mexicans. So how much do you think you can take? You will be, it will swallow, you'll be really red, some crusting in the following days.
Should we treat only the forehead
I
and
think
scalp, or
can
also
leave
treat
that.
the cheeks?
It's needed to
The
treat
cheeks
that.
and
but-
nose
Yes, the
also?
cheeks are.
But maybe,
Nose also?
but maybe not on one day,
Okay.
since the patient don't know what will happen now. So the first time it can be a little overwhelming.
And there will
So-
probably some remaining cream to treat them both, another time if needed. But the other curate is more effective.
That
Or
one.
no, the other one.
The other one.
It's sharper.
Yes, this one is maybe too smooth. That's fine because it doesn't have hyperkeratotic lesions.
Normally you say you use number 7.
Yes, of the other.
So the same as the other, but the diameter is larger.
It's the biggest than the.
Are there any studies comparing curettage and microdermabrasion?
No.
No?
We have a study comparing curettage and dermal roller in patients with AK and photodamage, but with a conventional PDT with a red light, showing that dermal roller improves the photorejuvenation effect, but on the AKs it was the same. But no study comparing microdermabrasion and the curettage.
Tomorrow they feel more painful than today,
No, you will not have pain tomorrow.
and tomorrow not.
No, the pain is now.
The rest of it.
Maybe the pain it can be now.
On-
It's just stinging when the cream is applied, but then outside he should not have pain, and the next day he should not. But of course he will have to put a hat and her voice on exposure, because if he comes back home tonight, rinse the Medvix, and then sleep and go under the sun tomorrow, then maybe there will be some remaining PP9 form during the night, and he could have some pain. So he has for the 2 next days to protect and avoid the sun exposure.
Can you get more out of that one?
No.
In how many days do you see the patient after the treatment?
I don't see them after
No.
the treatment.
3 months
No?
after for
Yeah.
efficacy.
3 months.
Yeah.
Yes.
3
You need
months
another
for
one?
to put another ones or
Only
Only for two.
to judge if more is needed.
Okay.
And that is very different actually. And if they are thick, they get two treatments with a week or two's interval. I'll take over here.
Is that okay?
Does it hurt?
No. A little bit.
A little bit, yes. And that will disappear in a few minutes normally. Not more. That's okay.
No, me causa curiosidad, ¿no? Que los demás sí no nos conocemos, pero los que más o menos ellos contemporáneos, 3, 4, 5 años, como que hoy llevamos a cumplir 25 años, ¿no? En el 2016, 2 años.
Yes.
A ver qué hacemos.
Un viaje.
Un viaje a Veracruz para que se recuerden su pasado. Para que
So,
vayan y bailen.
sometimes the day after,
A mi hotel, les invité, ellos llegan solitas.
then sometimes when you treat up here, it can a little liquid can go down in around the eyes so that they can nearly close. That happens in a few cases.
Okay.
Don't be afraid if it happens; it will disappear.
Okay.
Yeah.
How are you?
I'm good.
Okay, so did you have any pain with the treatment?
I had discomfort, more than pain. Pain, the kind of pain where you have to grip like this, no. I had discomfort and I had some feeling of, I hope what he's doing is going to end soon. But aside from that, no real pain. No pain that would cause your stomach muscles to go tighter, and nothing like that.
Thank you, David. And can you tell a number in a scale maybe 1 to 10? How painful was that? Being 1, almost nothing, 10 is the worst pain that you had?
In the overall,
Yes.
4,
4.
3.5.
For how long that was that 4 number?
Oh, most of the time it was around 2 or a 3 or a 4. Occasionally it might have been a 5 or a 5.5, but
Great. And right now, which is 30 minutes after the treatment, do you have any discomfort? Any
None.
sensation?
no, none,
None.
nothing.
Okay.
It feels perfectly normal.
If I tell you that you're gonna have this treatment maybe in 3 to 6 months, would you have another treatment?
Absolutely. No hesitation at all. Oh, it was a very, very fine experience.
Great. Thank you, David.
You're entirely welcome.
Sí, bueno, mi nombre es Hugo Muñoz Michel. Tengo 64 años de edad. Nunca me había ofrecido un tratamiento de este tipo, pero sí tenía la piel bastante reseca. El tratamiento lo esperaba un poquito más doloroso, pero la realidad es que el doctor muy profesional y pues no, ningún malestar en absoluto, ¿verdad? Lo recomiendo ampliamente. Es un raspado que hacía la limpieza, pero no de ninguna manera doloroso, ¿no? O sea, un raspado que se podía digerir.